CBS2 is committed to breaking the stigma around mental health, and that's why we're focusing on a topic this morning that can be really difficult to talk about, but it's vital to explore. March is Self-Harm Awareness Month, and recent studies have found that up to half of adolescents in the U.S. have engaged in self-harm at least one time, often starting between the ages of 12 and 14. Joining me now is psychologist Dr. Jennifer Hartstein, whose practice specializes in treating young people. Welcome.
Thanks for having me.
So let's talk about what self-harm is.
So self-harm in kind of clinical terms is non-suicidal self-injury. And what it is it's any deliberate act that you cause physical damage to your body. That can be done cutting, burning, scratching, punching yourself, punching the wall to create bruises, anything like that that's very deliberate. But the difference is it's not necessarily suicidal intended, which is a big myth. So it really isn't meant to kill you, but it's meant to do other things like regulate your emotions.
Why do people engage, in self-harm?
So there's a lot of reasons that people engage in self-harm, and there is another myth that it's attention-seeking. And in my practice, we really talk about the fact that it's not about getting your attention, but it is behaviorally effective to communicate to you that I'm in a lot of pain, and so self-harm might help me feel an endorphin rush. So if I'm feeling numb, all of a sudden I feel something. Maybe I'm feeling so much that it calms me down, and for some people it is a form of self-punishment. So those are the main three reasons that people do self-harm.
And I also find that I've talked to friends who actually have gone through this and say that sometimes that's the only control they have. They feel like their lives are spinning out, and so they can control the pain, actually.
Absolutely.
All right, those who engage in self-harm tend to hide it.
Yes.
So what are some signs to look for?
So unexplained cuts, bruises, any sort of injury that doesn't really have a clear answer is one thing to look at. Oftentimes, that age-old idea that long sleeves are being worn when you wouldn't expect long sleeves to be worn, that's accurate. Or maybe your child used to be very open and now they're very closed off. Or they leave the room and come back 10 or 15 minutes later in a different mood, something more elated. You want to start to question that. Any change in behavior, and you and I have talked about this before, if your gut's saying any change in behavior is happening that you can't quite understand, do some deep digging and ask some questions.
And how can you support someone who engages in self-harm?
Having this conversation is a start, right? We don't understand it, so learn more about it. Learn what you can do to create a safe environment in your home, and that might mean locking up scissors, locking up knives, anything that they could use to hurt themselves. Kids are crafty, they might get around it, but try. Ask questions. Don't be afraid to lean in and ask the questions. Validate how they're feeling and access help when you can. I think that's always the hardest part, but go to your pediatrician, go to other professionals to ask some questions.
Such a hard topic to talk about, but so important, because I think because everyone hides it very often, people don't think it's happening.
Right.
So.
And we know that they might grow out of it, but when they're in it, it's really a problem, and it's such a prevalent problem. We really want to be able to address it as well as possible.
All right. Dr. Jen, thank you so much for all the work you do, and we'll be right back.